Hello everyone, welcome to the Smart RN channel. My name is Henry. We continue with our series on the cardiovascular system, and today in this video we are going to look at atrial flutter, which is one of those heart dysrhythmias experienced by patients with cardiovascular conditions. So let's get started. Now, atrial flutter is a heart dysrhythmia where the heart's upper chambers of the atria beat too fast or rapidly. Now, this dysrhythmia is caused by an abnormal electrical signal which is issued by cells or by pacemaker cells other than the SA node. Remember, we said that in a normal heart's electrical conduction system, it is the SA node which is the primary pacemaker. But in this condition, we are seeing other abnormal cells issuing abnormal electrical signals which end up in the development of this particular atrial flutter rhythm. Now, in atrial flutter, there are no P waves, but instead we have flutter waves. And these flutter waves are represented, or they are presented in a sawtooth pattern. Now, one of the major characteristics of atrial flutter is that their waves take on a sawtooth pattern. You can easily differentiate between this rhythm and atrial fibrillation by comparing their waves. So these flutter waves are in form of a sawtooth pattern. Now, we have just said that in atrial flutter, the heart beats at a very fast rate. It beats at a rate of between 250 to 300 beats per minute. Now, unlike atrial fibrillation, atrial flutter is a regular rhythm. Remember, we said in AFib or in atrial fibrillation, the heart beats at an irregular rate. And remember, we said it is chaotic. When we have atrial fibrillation, we have chaos in the heart because every cell, different types of cells are issuing electrical signals at different times. So atrial fibrillation is chaotic. But in atrial flutter, the rhythm is a bit organized and it is regular. So we don't have those chaos which are experienced in atrial fibrillation. Now, what are the causes of atrial flutter? One, we have acute myocardial infarction. When you have conditions or problems with the heart muscle, there's a likelihood of sending the rhythm into a flutter. We also have chronic obstruction pulmonary disease or COPD. We have thyrotoxicosis. This is where we have got elevated thyroid hormone. The thyroid gland releases high amounts of thyroid hormone. So you have a likelihood of having this kind of patient getting or developing atrial flutter. We also have surgery. Those patients who are undergoing cardiac surgery, for example, coronary artery bypass, they may develop atrial flutter. We have digoxin toxicity. Patients could enter into atrial flutter as a result of digoxin toxicity. Remember, digoxin is that drug which is used to strengthen the heart pumping, at the same time reduce the heart rate. So we normally say that we aim at achieving a positive inotropic effect and a negative chronotropic effect with this particular digoxin. So digoxin toxicity could result in atrial flutter. And then some people, it could be due to congenital diseases, congenital heart diseases. They may be born, these are conditions, they are born with heart conditions, which may result in this particular atrial flutter. Now, for the signs and symptoms of atrial flutter, they are the same as those in atrial fibrillation. Remember, we said that the signs and symptoms of atrial fibrillation are shortness of breath. We have palpitations. You feel like the heart is bursting out of the chest. We also have dizziness. We have lightheadedness. We have reduced cardiac output. Those are signs of atrial fibrillation. So the signs of atrial fibrillation are the same as those ones for atrial flutter. So I would request you to go and review, if you have not done so, review that video on atrial fibrillation to be able to know about the science of this particular atrial flutter. What are the risk factors of atrial flutter? Now we have those factors that can predispose a patient to atrial flutter. We have obesity. This is excessive weight. So we have to take care of our weight. We have heart diseases. That those patients with heart diseases like valvular problems, like they have a mitral valve problem or like mitral valve prolapse. Those conditions can send a patient rhythm into atrial flutter. We have hypertension, high blood pressure, diabetes, elevated blood glucose. We have lung diseases, and even obstructive sleep apnea has been known to trigger this particular atrial flutter. How do we treat atrial flutter? Now, in atrial flutter treatment, the main goal is to control the heart rate. Remember we said it's a regular rhythm, but even though it's a regular rhythm, the upper chambers are beating too fast at a rate of 250 to 300 beats per minute. That's very, very fast. So the major goal in atrial flutter is to control this heart rate or this ventricular rate. Remember, when the ventricles, the atria pump blood in the ventricles, then the ventricles pump blood into the lungs for oxygenation or into the body for the supply of nutrients and removal of waste. So to be able to achieve for this ventricle to pump blood, then we must control the heart rate so that we can bring we can achieve that blood pumping into the lungs and in the body. Now, we have got various ways in which you can control the heart rate. One is by use of drugs, the beta blockers. Beta blockers are those drugs that end with LOL, propranolol, metoprolol, carvedilol. Those are drugs which are used to control the heart rate. We also have the calcium channel blockers. Remember diltiazem? Those are drugs that can use to control the heart rate. So we can be able to control the heart rate by use of beta blockers or calcium channel blockers. Then we also have anti-arrhythmic drugs, and especially amiodarone. We can use this drug to be able to achieve heart rate control. So after we have controlled the heart rate, we can be able to use amiodarone to try and convert or to try and obtain or get rid of this particular rhythm. We also have cardioversion. Cardioversion is a procedure. It is a procedure that we use to convert the heart's abnormal rhythm into a normal rhythm. Remember, atrial flutter is not a normal rhythm. So to be able to convert this rhythm into a normal heart's rhythm, a sinus rhythm, we can use cardioversion. And the cardioversion is a procedure that we can achieve by use of medicines or electronically. Now, medical cardioversion can be obtained by using medicines like adenosine, amiodarone, and even diltiazem. And electronic cardioversion can be achieved by use of a defibrillator. This is a machine that is able to deliver shocks to the heart. It delivers shocks to the heart by synchronizing those shocks with the peak of the QRS complex or with the peak of the R wave, so that we can be able to convert this rhythm into a normal rhythm. We can also perform cardiac or catheter ablation. Remember, we said that in this rhythm, we have got abnormal electrical signals that are produced by cells other than the SA node. So we can destroy those cells that are producing these abnormal electrical signals by use of laser beams. Laser beams can be used to destroy those particular cells so that they do not produce that abnormal electrical signal. And then, what are some of the complications of atrial flutter? Remember, we can have reduced cardiac output. A patient can, we have reduced cardiac output because this heart is not having enough time to fill up so that it can be able to deliver enough blood to the lungs or even to the body. We can also have blood clots developing because as the atria are just beating so fast. They don't have the blood. The blood ends up pooling in the atria, and this might result in blood clots. We also have stroke. This patient might develop stroke because of this particular blood clots, pulmonary emboli. The blood clot may just break and start traveling and go and lodge into the lungs, pulmonary emboli. So those are some of the complications that can result from this particular atrial flutter. So what are the nursing interventions? As a nurse, when you are caring for these patients with atrial flutter, or when they're having the atrial flutter rhythm, what do you do? So one, you have to stay with this patient. So we are staying, as a nurse, we are staying with this patient as we assess them. And what do we assess? We are assessing the vital signs of this patient. We are assessing their heart rate. We are assessing their blood pressure. Because remember, the atria, they are beating at a very fast rate. So we are assessing their blood pressure. We are assessing their heart rate. We are assessing their level of consciousness. Are they having change in level of consciousness? Assessing their pulses. How are those pulses? Are they so fast as a result of this heart rhythm? Then also obtain an EKG, electrocardiogram. Remember that diagrammatic representation of the heart's electrical system. So we obtain an EKG. In normal cases, doctors will issue an order, and then we'll have technician who will come and obtain that particular EKG. So ensure that an EKG is obtained. Administer ordered medication. These patients have medication. Doctors are prescribe providers are putting orders for medication like maybe beta blockers, calcium channel blockers. Make sure you are actually administering those medicines as ordered by the provider. Prepare this patient for cardioversion. We may need to perform cardioversion to convert this particular rhythm into a normal rhythm. For example, clean the patient's chest, because that's where you're going to put those electrical parts. If there is hair, clip that hair off and all that. So prepare the patient for cardioversion. And then you also ensure that the patient has a patent IV. Ensure a patient has a working IV access. We might have a case whereby we need to infuse medication directly into the patient's circulatory system. So ensure that this patient has an IV and that IV is actually working. In most cases, these patients are going to be on some form of cardiac monitoring. If they're in the ICU or step-down units, they're going to be on cardiac monitoring. If they're in inpatient units, we are going to put them on telemetry. So monitor these machines so that you can be able to see how the patient is actually faring on at different times. So those are some of these particular interventions that as a nurse you can be able to do as you care for this patient. And always update the providers if there's any change in the condition, anything you need to do. If you seek orders, be able to inform the providers. And also as a nurse, anticipate anti-anxiety orders, because these patients are going to be anxious. So we may also have anti-anxiety medications ordered for this particular patient. So anticipate those particular anti-anxiety medications. So that brings us to an end on this video on atrial flutter. And as always, please drop a comment, like this video, share this video, and if you have not subscribed to this channel, please do so. And from me here, it is goodbye.